Look, you've got a sleep apnea C&P exam coming up, and you're watching YouTube videos probably around 2 a.m. trying to figure out what the hell is about to happen to you. First of all, I get it. I've been there. The VA doesn't exactly hand you a user manual and all this stuff. Second, you've probably already watched like 6 videos from people who may or may not have any idea what they're even talking about. So let me save you some time. I am Dr. Marshall Bahr. I am a physician, not a nurse practitioner, a physician, not a PA, not a chiropractor, not a dentist, not a guy who took a weekend course and now calls himself a medical consultant. An actual medical doctor who went to medical school, did residency, and has been practicing medicine for years. I am also an Army Ranger, a combat medic, a disabled veteran myself, and someone who's actually done these exams before. So I've sat on both sides of the table. And today, I'm going to walk you through exactly what happens during a sleep apnea C&P exam, step by step, so you're not walking in blindly. Okay, so real quick, who am I and why should you actually listen to me? I am the founder of Xterra Health. We help veterans with nexus letters, DBQs, and medical opinions for VA disability claims. That's what I do and what we do every single day. But now, here's the thing that actually matters for this video. I'm a physician who understands both the medical side and the VA side. And I've personally conducted C&P exams. I know what the examiners are looking for because I've been the examiner. Now, why do I keep emphasizing physician? Because if you've been doing your research on YouTube, and I know you have because you're all veterans, you've probably noticed there are a lot of people out there making videos about VA claims and C&P exams. Some of them are great. Some of them are, well, let's just say their medical credentials are creative at best. I saw one guy the other day, a chiropractor. He was giving detailed medical advice about the VA evaluations, about how they evaluate respiratory conditions. Brother, you adjust spines. That's great and all, but maybe stay in your lane. I'm not saying this to be arrogant, right? I'm saying it because when you are preparing for an exam that could affect your benefits for the rest of your life, you deserve information from someone who actually understands the medicine behind it. So that's who I am. So now let's get into talking about the exam. First thing you need to understand, your sleep apnea C&P exam will probably not be conducted by a VA employee. The VA contracts most of these exams out to private companies. The big ones you'll see are LHI, VES, or Veterans Evaluation Services, and QTC. So you're going to get a letter or a phone call scheduling you for an exam at some random medical office you've probably never heard of. Don't freak out. That's completely normal. Now here's where it gets interesting and where a lot of veterans will get confused. The person examining you might be one of several people. A physician like me, a physician assistant, a nurse practitioner, or in some cases, depending on the condition, other licensed healthcare providers. For sleep apnea though, specifically sleep apnea, you're probably going to see either a physician assistant, or a nurse practitioner. And here's something I want you to really, really hear and let resonate with you. The quality of your examiner matters. Some are thorough, some rush through it. Some actually read your file beforehand, some don't. I mean, you can't control it, and you can't control who you get, but you can absolutely control how you prepare and how prepared you are. That's what this video is about. So let's talk about exam day. I'm going to walk through it. You're going to show up to some medical office, usually a pretty standard clinical setting, nothing fancy. The VA says to arrive 15 minutes early. I'm going to say arrive 20 to 30 minutes early, just because one, if you're late, they can cancel your exam and rescheduling it is a pain in the ass. 2, there's usually paperwork. So I know, shocking, right? VA paperwork, who could have predicted it? But you're likely going to get there and fill out some intake forms. Basic stuff about your medical history, your symptoms, your current treatment. Some of this might feel redundant because it's already in your file, but just do it anyways. Be thorough. Now, here's something a lot of veterans don't realize. You can actually bring supporting documents with you to that exam. If you have a recent sleep study, bring a copy. If you have treatment records from your private doctor, bring copies. If you have a buddy statement from your spouse about how your snoring sounds like a chainsaw fighting a garbage disposal, bring it. The examiner may or may not look at it during the exam, but you can request that it be added to your file. Listen, more evidence is always going to be better than less evidence. Okay, now let's get into some of the important stuff. The examiner is going to do a complete something. They're going to complete a form called a DBQ, a Disability Benefits Questionnaire. It is specifically for sleep apnea. This is the document that gets sent to the VA rater who actually decides, your rating and your claim. The examiner doesn't decide your rating. The examiner fills out the DBQ. The rater is the one that actually makes the decision. The examiner does not decide your rating. They document, the rater decides. This is important because some veterans walk out of their exam thinking they got denied because the examiner seemed skeptical or didn't say much. That's not how it works. So what is on this DBQ? Let me break it down section by section because I do these all the time. Section 1 is the diagnosis. The examiner will document what type of sleep apnea you have. We've got 3 types. There's obstructive sleep apnea, which is the most common, where your airway starts to get blocked. There's central sleep apnea, where your brain doesn't send the right signals to your breathing muscles. And then there's the mixed or complex sleep apnea, which is usually a combination of both. They'll also note the date of diagnosis and the unique ICD-10 code. Here's an important thing though. Your diagnosis must be confirmed by a sleep study. If you haven't had a sleep study, you don't have a confirmed diagnosis in the VA's eye, period. Don't file for it. If you file a claim without a sleep study, the examiner is going to maybe order one, but probably not. So ideally, you should have already done this before you filed. Section 2 is the medical history. The examiner is going to ask things about when did your symptoms start? How have they progressed over time? What treatments have you tried? And you want to be specific here. Don't just say, I've had it for a while. Say, I first noticed symptoms in 2019 when my wife told me I was gasping in my sleep. I was diagnosed in 2020 after a sleep study at XYZ VA. Dates matter. Details matter. Section 3 is treatment. And this is a big section, right? The examiner is going to document things like, are you on continuous medication? Do you use a breathing assistance device like CPAP? And I can't stress this enough. You need to pay attention here because this is where the rating for sleep apnea right now comes from. Under the current rating criteria, and I will talk about potential changes in a minute, but if you require a CPAP machine, you are looking at least usually a 50% rating. So the examiner is going to ask, do you have a CPAP? Do you use it? And how often do you use it? And here's where I'm going to give you some real talk, all right? Your CPAP machine, you need to realize it tracks your usage. Modern CPAPs record data. How many hours you use it, how many apnea events you're having, mass leakage, all of it. The examiner can request this data. The VA can request files for this data. So you have a CPAP, and if you're not using it, that becomes a problem. I'm not telling you to lie. I'm telling you the opposite. Use your CPAP. It's prescribed for a reason, and consistent usage will actually support your claim and treat your symptoms. Section 4 are signs and symptoms. The examiner is going to go through a checklist. Do you have persistent daytime sleepiness? Do you need daytime naps? Do you have chronic fatigue, morning headaches, difficulty concentrating, memory problems, or mood changes? When they ask any of these questions, don't just say yes or no. Give them concrete examples. Give them context. Yes, I have persistent daytime sleepiness. I fall asleep in the meetings when I'm at work. I fall asleep at red lights. I have to pull over on long drives because I'm so sleepy. You really want to paint a vivid picture here. Make it real for them because the examiner is writing this down and those details matter when the rater reads it later. Section 5 is the functional impact. This is the how does it affect your life section. One of the most important sections. The examiner will ask how your sleep apnea impacts your ability to work and perform daily activities. Listen, this is your chance to explain what this condition actually costs you. So talk about, what it does to your work performance, your relationships, safety concerns. Have you been falling asleep during a drive? Quality of your life, other health issues caused or maybe even worsened by poor sleep. I don't want you to minimize this section. So don't be stoic. This is not the time for I'm fine and I'm just toughing it out. Now, let's get into what actually won't happen at your exam. The examiner will not tell you your rating that you're going to get. They won't say, looks like you're going to get 50%, or I think you'll be denied for this. If they did, they're going to be overstepping and they shouldn't be doing that. That is not their job. Their job is to document your condition accurately. The rater's job is to apply the rating criteria to that documentation. So don't walk out feeling bad because the examiner was quiet or didn't give you a thumbs up. That's not how this works. Also, the examiner will not give you a nexus opinion on the spot. If your claim involves service connection, meaning you're trying to prove your sleep apnea is connected to your military service or one of your other service-connected conditions, the examiner will provide a medical opinion after the exam in their report. They might ask you questions about when your symptoms started, what happened during service, whether you had any events or exposures that could be related, but they're not going to look at you and say, yeah, this is definitely service connected. That opinion goes in the written report, and you won't see it until after the VA has actually made their decision. So quickly, I want to talk about some of the important updates that are actually coming that you need to know, that I think it is something you need to know. The VA has proposed changes to how they're going to rate sleep apnea. So under the current rules since 2022, the current criteria is you'll get 0% if you're diagnosed and you don't have really any symptoms, 30% if you have persistent daytime sleepiness, a 50% if you're requiring a CPAP device, and then it's 100% if you have a really, really bad chronic respiratory failure requiring like a trach tube. But under the proposed criteria, which could be implemented in 2026, the automatic 50% for CPAP is going to go away. They're going to introduce it at a 10% rating level if you're using CPAP and it's controlled. Ratings would be based more on symptom severity and response to treatment, not just whether you use a CPAP and are prescribed a CPAP. So as of right now, the current criteria still applies. No final rule has actually been published yet. But this is why you should not delay your claim. If you have sleep apnea and you're putting off filing your claim, file now. Get evaluated under the current criteria while you can still get grandfathered in. I'm not trying to scare you. I'm trying to make sure you are informed. All right, let me give you some rapid fire tips now for your exam. All right, 1, review the DBQ before you go. It is publicly available on Google. Just look it up. I will link it in the description if I need to. Read through it so you know what's coming. No surprises. 2, bring copies of your sleep study. Even if it's in your VA records, even if you submit it, just bring a copy. Highlight the important parts, your AHI score, the diagnosis, the recommendations. 3, bring your CPAP compliance data if you can. Some machines, remember, they have apps. Some have SD cards. If you can print a report showing consistent usage, bring it. 4, don't downplay your symptoms. I know we were all trained to suck it up and drive on the service. That mentality will cost you money in your C&P exam. So describe your worst days. Describe the real impact. Be honest, but be complete. 5, stay calm and professional. Even if the examiner seems rushed or dismissive, stay calm. Answer thoroughly. Document everything yourself afterward. What was asked, what you said, how long the exam lasted. If you felt the exam was inadequate, you have options to challenge it later, but you need documentation. So that is what you need to know about your sleep apnea C&P exam. Let me leave you with this. The VA system is not designed to be easy. It is not designed to be intuitive. It is a bureaucracy, and, well, bureaucracies are frustrating. But you've already survived things that were way harder than a C&P exam. You have got this. So just prepare. Show up. Tell your truth about how this condition affects you, and let the process work its way out. If you need help with a nexus letter or an independent medical opinion for your sleep apnea claim, that is what we're here to do at Xterra Health. The link, again, is in the description if you need help with that for a free medical consultation. We've helped thousands of veterans get the ratings they deserve, and we have the highest win rates in the nation. I am Dr. Marshall Bahr, an actual physician, Army Ranger, disabled combat veteran. So thank you for watching. Now go crush your exam. I'll see you in the next one, and until next time, stay mission ready.